Today we're going to discuss the vagus nerve and its impact on the GI tract and then the resultant gut-brain axis impact of the vagus nerve. And we're also going to talk about one therapy to stimulate the vagus nerve called Transcutaneous Vagal Nerve Stimulation. And I think this will be very informative because there's many people out there reading health blogs, and many of the health blogs say the gut, start with the gut, it's the gut, it's the gut, it's the gut. And they're not incorrect, but I think people aren't fully informed on why it's the gut oftentimes. Sometimes it's the gut because it's the gut, which sounds silly, but that would be it's the gut because of the reason you're thinking. Like you have GI pain and it's actually the GI itself, say. Something intrinsic in the GI, like you have damage to the GI tract. But sometimes gut issues are not the gut per se, but an immune issue. And because up to 80% of the immune system is in the gut, oftentimes you're still going to address the gut. Or another thing that may be quote unquote the gut, but not the gut, is if you have vagus nerve dysfunction. So let's dive into that today. This video will be focused on the vagus nerve issues that may lead to the gut being the problem, okay? And this graphic shows us the vagus nerve as this yellow nerve here. And the vagus nerve comes from the brainstem. And this actually is not the most anatomically correct drawing of it. It comes from brainstem, from the medulla, and then it's the C1 nerve root from the top of the spine. Okay, so if you go to a chiropractor and you get adjusted and they do upper cervical adjusting and adjust your C1 vertebra, they're impacting the vagus nerve by doing that. So the vagus nerve leaves the brainstem, top of the spinal cord, and goes all over the place. Vagus is Latin for wanderer. And so the vagus nerve wanders, it supplies the face, the neck, and then heads down into the chest cavity and supplies lungs, heart, liver, GI tract. 85% of the parasympathetics below the splenic flexure. It does all kinds of stuff. It's wandering around and essentially is the major portion of what's called the parasympathetic nervous system. Okay, so the parasympathetic nervous system is the rest and digest side of the nervous system. And then you may have heard of the sympathetic nervous system, which is the fight or flight response. Okay, that's the stress side. And so if we're always under stress, then we're flexing that muscle, so to speak. We're flexing the bicep. And if you flex your bicep, then you can't flex your tricep, right? If you're flexing the bicep, then the tricep isn't being flexed. So if you're chronically stressed, you're inhibiting your vagus function, you're inhibiting the parasympathetic nervous system, you're inhibiting your ability to rest and digest and relax, right? Because your body thinks you're running from a tiger. And I've made a video on the stress nervous system in tigers, and I'll link to that here so you can go watch that. But today we want to focus on the vagus nerve and the parasympathetic nervous system. So the vagus, because it's a large chunk of the parasympathetic nervous system, it is controlling behind the scenes physiology. So things like heart rate and rhythm and breathing and blood pressure and digestion and absorption and stomach acid production, digestive enzyme production. Gut motility is a huge one. If you cut the vagus nerve, you have gastroparesis, which means basically your GI tract, your stomach isn't moving, and the stomach is the beginning of the migrating motor complex or downgoing peristalsis in the gut. So if you don't move things through, you're constipated, right? And chronic constipation causes all kinds of issues, one of which would be SIBO, or small intestinal bacterial overgrowth, potentially. So if you have SIBO out there and you've tried all the antibiotics and nothing works for very long, If you haven't investigated whether the vagus nerve is functioning optimally, then you may be continuing to develop SIBO not because of, super bugs, but because you're lacking down-flowing peristalsis. So stuff is sitting in there too long and being fermented by even normal levels of bugs and producing too much gas or bloating, or it's not being properly digested and leading to inflammation because proteins that are too large are hanging around in the GI tract and being addressed by the immune system. So this is a good image. We'll see other images of the vagus nerve, but this is a good image to understand the brain to the gut end of the vagus, which is the minor portion. The major portion of the vagus is the vagus back up, or the gut back up to the brain. So the gut brain gut loop is basically the connection of the brain to the gut is via the vagus nerve. So let's look at what the research says about it. So here we are looking at some research papers, and let's jump. Let's start here. One thing that the vagus nerve does powerfully. No, we'll come back to this one. Sorry. I want to start with this one. Okay, so this is a paper from 2020, a critical review of tVNS, challenges for translation to clinical practice. So what we're talking about today is tVNS, or transcutaneous vagal nerve stimulation. So this is the ability to stimulate the vagus nerve transcutaneously, or on the surface of the body. Okay, and this is non-invasive. Okay, it's just a simple electrode on the left ear. Now, one reason or one thing that led to development or a search for tVNS, or way to stimulate the vagus on the surface of the body, is because vagus nerve stimulation is successful for things like epilepsy and depression. Okay, but vagus nerve stimulation is invasive. Okay, they have to invade and actually stimulate the vagus nerve inside, whereas tVNS helps us do it on the surface. So if we can be less invasive, lower side effects, etc., then and equal benefit, then this is an easy way to positively impact depression, epilepsy, autism, inflammatory bowel disease, all kinds of things, as we'll talk about today. So this study is looking at it, and it's saying several studies have illustrated tVNS can elicit therapeutic effects similar to those produced by its invasive counterpart, VNS, vagus nerve stimulation. Vagus nerve stimulation is FDA-approved therapy for both depression and epilepsy. Okay, so this paper is looking at tVNS, the non-invasive form, is using electrical currents, most commonly on the auricular branch of the vagus nerve and also on the cervical branch of the vagus nerve in the neck, to change the activation of different areas of the brain involved in anxiety and mood. So there's some graphics down here that help you understand what we're talking about. So if we're looking at the ear, and we only use it on the left ear, okay, because the left vagus is doing more of the GI tract functions. The right vagus on the right ear has more to do with the heart. So we, don't use this therapy without speaking to your provider first, and B, if you're not wanting to affect the heart and mess with heart rate, rhythm, etc., do not put it on your right ear. And if you have a pacemaker or medical implants at all, don't put it on your left ear either before first speaking with your provider and getting clearance there. So with that out of the way, graphic A here is of the left ear, and where we want to stimulate the auricular branch of the vagus nerve is right here in this brown area, okay, which is now blue. But that is where we want to impact, that's where we can impact the auricular branch of the vagus nerve from the surface most easily. You can also impact the vagus nerve in the area of the neck, not as easily because of soft tissue and other muscles, but it is possible, but it's most easily done on the ear here. So this study is talking about that. And let's jump over to this study, vagus nerve as modulator of the brain-gut axis in psychiatric and inflammatory disorders. The vagus nerve represents the main component of the parasympathetic nervous system. Okay, we talked about that earlier. That's that rest and digest side of things, which oversees a vast array of crucial body functions, including control of mood, immune response, digestion, and heart rate. The vagus nerve establishes one of the connections between the brain and the GI tract and sends information about the state of the inner organs to the brain via afferent nerve fibers. So afferent fibers are the ones going back to the brain, okay? This makes the vagus nerve an attractive target in treating psychiatric and GI disorders. Preliminary evidence says it's a promising add-on treatment for treatment refractory depression. So that's depression where they've tried medications and they've tried maybe electrical shock therapy or transcranial magnetic stimulation or different things, and depression hasn't improved. Well, they try tVNS, and that's helpful for some of those people. It's also promising for post-traumatic stress disorder, PTSD, and inflammatory bowel disease. Treatments that target the vagus increase vagal tone and inhibit cytokine production. So it increases vagal motor outflow, which will provide anti-inflammatory effects from the vagus, increase motility, etc. And inhibiting cytokines is inhibiting inflammation. Both are important mechanisms of resiliency. So if we want to be healthy or resilient, right, we want to have optimal vagal tone, and we want to inhibit inappropriate cytokine or inappropriate immune response. The stimulation of vagal afferent fibers in the gut influences brain systems in the brainstem to play crucial roles in major psychiatric conditions such as mood and anxiety disorders. There's preliminary evidence for gut bacteria to have beneficial effect on mood and anxiety, partly by affecting the activity of the vagus nerve. So you see this interplay, you know, everything says it's the gut, but really the gut is the gut, the microbiome, the nervous system, the immune system, the environment, it's everything, okay? Everything's involved there. It's not just your colon where your probiotics are, right? Since the vagal tone is correlated with capacity to regulate stress response and can be influenced by breathing, its increase through meditation and yoga likely contribute to resilience and mitigation of mood and anxiety symptoms. So again, we're talking about tVNS today, but we've also talked in the past about other parasympathetic stimulating therapies, right? Anything that rests you and relaxes you. Meditation, yoga, diaphragmatic breathing, grounding, petting a dog, reading a book, whatever you know relaxes you, those things stimulate parasympathetics. Okay, so if we look at this image, again, we have the brain to gut, gut to brain loop, and that loop is the connections between those two things is the vagus nerve. And you can see here, only 10% of the vagus is used for the downgoing from brain to gut side. But you can see here, 90% of the vagus nerve is actually afferent, or going from gut back up to brain. So telling brain about what's going on down here. So the vagus nerve, the 90% that's talking to the brain, is telling it about inflammation, about hunger and satiety, about fullness, about energy metabolism, about, hey, we've secreted stomach acid, we've secreted digestive enzymes, all that stuff, right? And the 10% from the brain is, brain picks up that you're eating and it says, hey, release stomach acid, release digestive enzymes, etc. So you can see all kinds of functions here. And if you have disorders in the brain gut brain loop, you might have depression, you might have PTSD, you might have ulcerative colitis or Crohn's disease, or constipation in a more functional GI disorder sense. You might have constipation, or you might have SIBO, or you might have acid reflux. There's a whole bunch of possibilities. Going to the next study here. Parameters matter. So modulating cytokines, which basically is, we could say, inflammation using nerve stimulation. The vagus nerve-based inflammatory reflex regulates inflammation and cytokine release. These patients or this paper is talking about recent successful clinical trials they used implantable bioelectronic devices demonstrate the efficacy of targeting neural circuits as efficient alternative to drug treatments. So they're with implantable bioelectronic devices, that's more of a vagus nerve stimulation, more invasive, right? Because they're implanting someone. But if those work, then our principles are, can we use tVNS to do the same thing? And so this study showed that modulating the vagus nerve here selectively lowered serum tumor necrosis factor levels. Well, TNF is one of those big three major pro-inflammatory cytokines that we've talked about in the past. TNF, interleukin-1 beta, interleukin-6. So if we can decrease those things in patients with inflammatory diseases, we can positively impact disease outcomes. How about stroke patients? Vagus nerve stimulation in ischemic stroke. Here's a paper from 2014. Vagus nerve stimulation is currently FDA approved for treatment of both medically refractory seizures and severe recurrent depression. Because of its ability to regulate mechanisms well studied in neuroscience, such as norepinephrine and serotonin release, the vagus nerve may play an important role in regulating cerebral blood flow, swelling, inflammation, glutamate excitotoxicity, and neurotrophic processes. So these authors want to investigate, after a stroke, does vagus nerve stimulation improve outcomes by improving blood flow to the damaged area, reducing swelling and inflammation, excitotoxicity, all those things, if not benefited positively, lead to further brain damage and worse outcomes in stroke. So this would be one thing to pursue in the context of ischemic stroke as soon as prudent, post-stroke, to prevent negative outcomes. And then here's a study that is hypothesizing that tVNS could be a treatment for autism. And they state a growing body of evidence shows that tVNS can activate the brain regions associated with autism spectrum disorder, trigger neuroimmune modulation, and produce treatment effects for comorbid disorders of autism, such as epilepsy and depression. We thus hypothesize that tVNS may be a promising treatment for autism spectrum disorder, not only for comorbid epilepsy and depression, but also for the core symptoms of autism spectrum disorder. So again, if you know anyone with autism, medical treatment isn't stellar. Okay, they're just, it's really symptom suppression. So if there's a treatment that's non-invasive and non-toxic that could address the core symptoms of autism, that would be, big for those families. Okay. And so what about the safety? Is it safe? Well, here's a study that is showing safety and tolerability of tVNS in humans. And so basically they say it is safe and well tolerated at the doses tested in research studies to date. And so there's various parameters used in the research studies, but it's been safe and effective, so far. And those were various studies looking at it. So if you are dealing with a gut brain gut disorder, then vagus nerve stimulation may be beneficial in your case, and you should talk to your provider about it. What might be predisposing events to a vagus nerve issue? Well, one thing would be head injury. Head injury from, say, concussion all the way up to stroke, to, motor vehicle accident, whiplash. There's various mechanisms by which head injury could affect vagus nerve function. If you've had radiation to the head, or you've had brain surgery, depending on where in the brain they're operating, it may have been impacted there. If you've had major gastrointestinal surgery, perhaps it could be impacted that way. But more on a functional level, if you're very stressed out and you're always flexing that stress bicep and never working that rest and relax tricep, that could create an imbalance in your autonomic nervous system towards more of a stress output. And again, if you're always stressed, you're not getting time and rest and relax. So that would be a functional imbalance there. So those are things to consider. And if you have head injury history, and ever since you've had headaches, or you've been more constipated, or you've had SIBO or whatever, it may be something to consider.